Hello. On October 22nd, there was a press release related to a technology out of Northwestern University for a treatment alternative to the gluten-free diet for celiac disease. Of course, this came as good and welcome news after that a vaccine candidate out of a technology from Boston here, from a private company, unfortunately had negative outcomes. And therefore, we were very distressed by those results. But now we're energized by this new finding that were presented a couple of days ago in Barcelona at an international meeting in which they used these nanoparticles in which gluten fragment were embedded so that this will teach the immune system to tolerate gluten. Again, very exciting preliminary results because it looks like that the injection of these particles will decrease the inflammatory response of people with celiac disease if exposed to gluten. There's a lot of excitement. We received a lot of inquiries from patients about this technology, also because it was claimed that finally we have a cure for celiac disease. Why promising this is running too fast? Because again, these are exploratory studies. There's a lot of stuff that still needs to be done, particularly in concern of the safety profile of this new technology that anyhow remain very promising. I think that what needs to be also stressed out is that these are IV injections of these nanoparticles that will be picked up by specific immune cells that are called macrophages that will dump the immune response to gluten. At least this is the concept. So creating a conditional tolerance for people that have problem with celiac disease when exposed to gluten. The path is still long, but again, the only thing that we saw in the abstract and the press release is that this immune response in terms of production of pro-inflammatory cytokine was highly decreased. We didn't see yet in terms of if the symptoms were also ameliorated. We didn't see again a safety profile. So we are very much looking forward for the next trial to try to understand how this technology will proceed.